ambassadors. What is social anxiety disorder?
Social anxiety is a subset of anxiety disorders that is also sometimes known as social phobia. It causes excessive and unreasonable fear of social situations.
When sufferers are faced with social situations such as presentations or social events, they feel a significant amount of fear.
They fear being judged by others, even though many sufferers are aware that their fear is irrational.
When the fear becomes too much to handle, some sufferers may even experience panic attacks.
How can I tell if someone has social anxiety disorder?
Most of the time, it is hard to tell if someone is suffering from social anxiety disorder.
Unless the people themselves tell you about their disorder, you should not make any assumptions about their condition.
If you suspect a friend of yours has social anxiety disorder, you can help by being supportive and kind to him or her, be it by helping them through tough periods or simply being there for them when they need you. You can also encourage them to seek professional help.
We will elaborate more in a future video.
What are some symptoms of social anxiety disorder?
Social anxiety disorder causes sufferers to experience an excessive and unreasonable fear of social situations.
Every sufferer has a different set of symptoms and different responses to social situations.
Some common symptoms in sufferers are intense anxiety in social situations, refusal to attend or avoidance of social events, reluctance to communicate with others, panic attacks, and some physical symptoms of anxiety, including confusion, pounding heart, sweating, shaking, blushing, muscle tension, upset stomach, and diarrhea.
Because of these symptoms, many sufferers are often seen as rude or arrogant. However, they simply cannot help the way they behave, as it is a consequence of their condition.
Instead of ostracizing them, we should help them integrate into society.
Social anxiety disorder has many causes, the most common ones being trauma during childhood and friendship problems. So please be mindful of how you treat your friends.
Although sufferers tend to avoid social events, do not confuse them with introverts, as introverts choose to avoid people, whereas sufferers are not able to control their fears and symptoms.
Do also keep in mind that not all sufferers suffer from the same symptoms or to the same severity.
What happens during a panic attack?
A panic attack includes a combination of the following signs and symptoms: shortness of breath,
Hyperventilation,
heart palpitations,
chest discomfort,
trembling and shaking,
sweating,
nausea,
a choking feeling,
feeling unreal or detached from your surroundings,
feeling dizzy,
lightheaded,
or faint,
numbness or tingling sensations,
hot or cold flashes,
fear of dying,
and losing control.
What causes social anxiety disorder?
Social anxiety disorder can be caused by a person's genetic makeup, making a person more prone to developing social anxiety disorder.
It can also be caused by some kind of memorable embarrassing experience during childhood, such as an embarrassing individual presentation or messing up in public.
In a study conducted on sufferers of social anxiety disorder, about half of the affected people said that their phobia began after one unforgettable embarrassing experience, while the other half said that it had been with them for as long as they could remember.
Social anxiety disorder can be developed at any time during life, but tends to be more common in teenagers aged between 13 to 18 years old.
It is also more common in women, with just over twice as many women as men affected.
Why is this subject important?
Based on information from the patient website, a trusted and credible source for medical information and support, social anxiety is defined as one of the most common anxiety disorders. As many as 1 in 10 adults have some degree of social anxiety disorder.
It is estimated that 12% of adults in the USA will have social anxiety disorder at some point in their lives, higher than the percentages of other anxiety disorders.
According to an article on Health Exchange, a web initiative by SingHealth, 10% of the population in Singapore suffer from depressive and anxiety disorders.
A survey that we have conducted within secondary schools has shown that many of them were not fully aware of what social anxiety disorder is or what its symptoms were.
Out of over 500 respondents, 79.8% did not know or were unsure of the meaning of social anxiety disorder. Many of those who claimed to know about it also had many misconceptions.
What do we hope to do?
Since the onset of social anxiety disorder is usually in 13 to 18-year-olds, we wish to increase the awareness of social anxiety disorder among people 18 years old and below.
We hope to increase the level of understanding of social anxiety disorder in the general public.
Another goal of ours is to help people improve their communication with sufferers.
Disclaimer!
Even though you now know more about social anxiety disorder, please do not self-diagnose. If you suspect you have social anxiety disorder, do seek professional help.
Most schools have qualified counselors whom you can trust and are sure to help you.
All information stated in the video is accurate at the date of posting. We are not liable for any false information caused by future advances.
Thank you